Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. We're talking about transforming healthcare with AI technology at St. Luke's University Health Network. Tonight, we'll be joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at transforming healthcare with AI at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Donna Sable. Donna has been with St. Luke's for over 40 years, gathering and reviewing medical data to determine the quality of services and ensure the delivery of high-quality healthcare. During her time as Senior Vice President and Chief Quality Officer, St. Luke's has achieved numerous well-deserved recognitions. This includes St. Luke's recognition as the only Lehigh Valley-based healthcare system to earn Medicare's 5-star ratings, the highest for quality, efficiency, and patient satisfaction. Thanks for being here, Donna.
I'm happy to be here. Thank you for having me.
Please explain to us, in your role, why is quality so important? Why is it something that you have to keep a watch on and improve all the time?
Well, it's all about the patient and patient care, and at St. Luke's we want to assure ourselves that we're providing the highest level of care. So I like to say I have the best job in the network. I'm working with data, which I love data, and I get to work with our providers on the front lines to assure that the latest evidence and best care is being provided.
Joining our panel next is Dr. Eleanor Harris, who serves as Chief of Radiation Oncology and is Vice Chair of Oncology for St. Luke's Cancer Center. She received her medical degree from the University of Louisville School of Medicine. She completed her residency and fellowship in radiation oncology at the Hospital of the University of Pennsylvania. Dr. Harris has a special interest in breast cancer and gynecological cancer clinical research. She sees patients at St. Luke's Cancer Center at the St. Luke's Anderson campus in Easton. Dr. Harris, thank you so much for being here.
It's a pleasure to be here.
You treat patients who have been diagnosed with cancer, not an easy job. Can you tell us what is radiation oncology and how did you become interested in this field?
So radiation oncology is one of the three main specialties that provide cancer care. We deliver radiation treatment to patients. That can either be using external beam radiation, which is produced by a machine called a linear accelerator, or it can be radioactive sources that can be placed inside the body or injected into the body. So radiation oncology is a fascinating field, which is why I chose it to be my specialty. We literally treat all patients from pediatrics to geriatrics. We treat every part of the body from the scalp to the toe. We can treat patients post-operatively when the cancer has been removed, and that's often a modality used to preserve the organ, like the breast or the larynx. And then we treat the area around the cancer to prevent recurrence. We can treat patients with more advanced cancer who do not have operable disease, cannot be removed from the body. And then finally, at the other end of the spectrum, we treat patients with advanced disease, stage 4, that is spread to other parts of the body, and radiation is extremely effective at pain relief and other symptom relief. So we really get to improve patients' quality of life and help to cure or to alleviate the symptoms of their disease across the entire spectrum of cancer care.
Thank you so much for being here. Let's meet our final panelist, Dr. Jennifer Axelband, who specializes in emergency and critical care medicine. She serves as the Associate Medical Director for Medical Critical Care Education at St. Luke's University Hospital in Bethlehem. Dr. Axelband received her medical degree at Philadelphia College of Osteopathic Medicine. She completed her residency and fellowship in trauma and surgical critical care medicine at St. Luke's. Dr. Axelband, thank you for being here.
Thank you for having me.
Often your patients are facing serious illnesses, long journeys. Tell me about what drew you into critical care medicine.
I started off my training actually in emergency medicine, and I found I gravitated to those patients who were the sickest. And that led me into critical care. Surgical critical care medicine, and neurocritical care are all fields that I work in. Those patients depend on you. Everything that you do is potentially a life-saving intervention, and your team and your interaction with not only your patient but the family can be life-saving and life-changing. And that's where I feel that me and my team get the most fulfillment in taking care of our patients.
Thank you all for giving us some background on your expertise, but we're not done yet. Up next, we'll dig deeper into AI technology. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Complex conditions of the nervous system require extraordinary care. At St. Luke's, it begins with a compassionate team of neurosurgeons with incredible skill sets and advanced level practitioners experienced in caring for patients with conditions of the brain and spine. A neurosurgery visit does not always mean surgery is the only option. And when surgery is the best option, St. Luke's offers minimally invasive neurosurgical approaches. St. Luke's, the neurosurgical care you trust now more than ever.
AI is tremendously revolutionizing medicine. Developing AI is great if you're living behind the scenes and working in these workstations, but where does it really impact patient care? On the bedside. Having that kind of AI deployed on the systems that are literally taking patient chest x-ray in the ED, up in the ICUs, or any critical care unit, to say, is there an abnormality in this particular space, in this particular patient, at this particular time, and we get you that data within seconds. In the last couple of years, it has truly exploded. It's now moving to other ologies. It's moving to cardiology, nephrology, orthopedics. It's everywhere across the care continuum. As we look at deploying AI in the emphysema space, we can easily run on the back end and look at how our patients are affected by emphysema. Are they at risk for emphysema? Can we run that algorithm and say, you are at risk? Saving lives by preemptive treatment is really what we're going after here. Our goal is to use ChatGPT to kind of synthesize that data. Look at the patient chart, tell me what's in it. And so it becomes more relevant. We keep learning, we keep challenging ourselves, we keep seeing what's coming down the pike. We plan on sharing that data and collaborating with lots of institutions across this country to make sure we continue to get the best of the best.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank you, our viewers, for watching our program tonight and for providing us with questions for our panel. We'll get to those later in the show. Joining me is a talented group of medical professionals, Donna Sable, Dr. Eleanor Harris, and Dr. Jennifer Axelband. We've learned about their expertise, and now we're going to dive deeper into AI technology and how it's affecting healthcare. So, Donna, I'm going to start with you. Can you explain what AI is in basic terms, what fascinates you about it, and how it's affecting healthcare?
So AI, artificial intelligence, is really using machine learning and computers and data points to be able to predict things, in our instance in healthcare, about our patients. So an example would be using the data points for a patient, their vital signs, their lab values, for example, documentation in the record, feeding that into an algorithm that can help us predict if the patient is going to develop acute kidney injury, for example. So we can get ahead of the curve and treat those patients and prevent further deterioration in the patient. There are other examples of AI, such as an office product, where you can, it's called generative AI. So you can get an article, download it, and say to your computer, would you summarize the key points for me? No longer needing to read the article yourself. You can also say, off of those key points, can you generate a PowerPoint for me? So there are different areas within healthcare that we can use AI technology beyond just the clinical.
Yeah, really leaning into AI to help maximize our time. I think that's really important. And Dr. Axelband, I want to ask you, because in critical care, you're dealing with serious illnesses and various care team is involved. How is AI being used to rapidly detect diseases or something that could be going on in a patient that could be a matter of life and death?
AI in my field of medicine and working mostly hospital-based is taking all of the parameters that Donna was just talking about, vital signs, laboratory data, patient evaluation, and having that trended over time through a computer algorithm that allows for alerts and triggers to be set based on certain criteria and parameters. So, for example, we have a deterioration index that we use, and it's very important because patients can come in and we know they have, let's say, a pneumonia or a urinary tract infection, and they're hospitalized for that reason. They can rapidly deteriorate just by signs in their vital signs and things that are happening as maybe somebody's not in the room with them at that time. So those alerts will trigger my team to come and evaluate the patient to see, is this a true deterioration, or is this something that we're still okay and we just need to change a few parameters or a few treatment options.
Dr. Harris, I want to turn to you because Dr. Axelband is talking about a patient sort of in the hospital in that moment and monitoring them using AI. But in your field as a radiation oncologist, often there's a lot of planning that goes around. How do you decide what treatment plan is effective for each patient? Because as you described earlier, it's very varied.
First of all, there are evidence-based parameters that say what dose we should use, what volume of the patient's body we should treat. So these are all very standardized, and then obviously there is the unique aspect of every patient. Everyone's anatomy is unique, everyone's cancer is unique to them, so that's where the art of medicine comes in our field. Our general process is to obtain a 3D image of the patient's body, usually with a CT scan, and we're going to take that three-dimensional reconstruction of their body, we put it in our computer planning system, and we use that to generate a treatment plan. And so generally that is a very time-consuming process for us. We have to generate the volumes that need to be treated, so that would be the doctor designating the cancer inside the body. And then we have a team that works with us who actually go in and put on all the normal organs. There's really two competing factors in radiation treatment. You want to give the cancer the proper dose, but you want to limit the dose to any nearby normal organs so that you limit damage and side effects to those other organs. So one of the things AI has been helping in our field for a while now has been called auto-contouring or auto-segmentation, where based on tens of thousands of pieces of data from patient CTs, the planning system actually knows what those organs should look like, and it auto-contours them for us. And it can do that in seconds, whereas it might take our planners minutes or even hours to do a large number of organs. We were, in 2022, the first health system in the entire region to get a new technology which is called adaptive radiation therapy. And our machine is called the Ethos, and it's at our Allentown Center. And that is taking the AI capabilities really to the next level. So this is a machine where the patient is on the table, ready for treatment. We get a limited 3D but high quality image of the part of the body that we're treating. And the computing power of this machine, and using again the artificial intelligence and machine learning, allows the machine to recontour everything in real time. Normally this would take us hours, if not days. This machine does it in minutes while the patient is there. We can actually replan the dose that goes into the patient in real time. It takes a few minutes, and then we can treat much more accurately. So we can give higher doses to the cancer and lower doses to the nearby normal organs with this improved both accuracy and this moment's anatomy.
Such a great example of how it's directly impacting patients. And Donna, I wanted to ask you, you talked a little bit about how AI is enhancing and sort of changing the delivery of healthcare. What are some practical examples of how this improves the quality of patient care directly?
When we talk about the deterioration index that Dr. Axelband talked about, we know that patients are no longer bouncing back into the ICU. Often, the deterioration index is identifying that the patient is on a course of a downward trajectory before the clinicians can even see that in the patient's symptoms. So we can intervene ahead of time and prevent complications, decrease the length of stay that the patient will have, prevent the patient from going back into the ICU. It also has greatly reduced our incidence of cardiac arrest. And for those patients who do have a cardiac arrest, our outcomes have been significantly improved.
Thank you all for such great information. We're not done. After the break, we're going to learn more about the future of AI at St. Luke's University Health Network. You're watching St. Luke's Health Now. Stay tuned.
Hey guys, Mr. Wellness here from the Wellness 101 Show. Join me as we take a quick step-by-step journey of basic tips and tricks on how to stay healthy. From developing easy healthy habits to surviving allergy season and everything in between, the Wellness 101 Show is fun, educational, and designed to help you thrive. Be sure to subscribe to our YouTube channel by scanning the QR code and hit the bell icon to be notified of any future episodes. It's time to make healthcare fun with Wellness 101.
There are a number of different quality metrics we look at in our division to measure how well we're taking care of patients. One of the most important is called the adenoma detection rate. That's a measure of how often we find precancerous polyps when we perform routine screening colonoscopy. Another technology we've recently started using is called GI Genius. GI Genius uses artificial intelligence to analyze the screen while we're looking through the colon and look for any small polyps, small areas that are raised that could be precancerous polyps. When it notices something that could be a polyp, it puts a small box around it, so it's very easy for us to see, jumps out on the screen, and we can then focus on that area and determine if it is a polyp. In studies, that seems to improve our rate of finding precancerous polyps, and we're really proud to be able to offer that for our patients. Many people don't have any precancerous polyps, and we take a look inside the colon, don't find any, and that's great news. They come back in 10 years. But about 40% of people do have precancerous polyps, and it's really critical that we find those polyps when they have them and take those out. And so the better we are at finding those polyps, the better we are at preventing colon cancer and giving patients accurate diagnoses.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have had an interesting show tonight. We're talking about transforming healthcare with AI technology at St. Luke's University Health Network. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Donna Sable, Dr. Eleanor Harris, and Dr. Jennifer Axelband. Thank you all for being here. We've talked a little bit about your very different specialties, why you got into your fields, and how AI is helping you do your job and patient care better. But now I want to talk a little bit more specifically. So Dr. Harris, let me talk with you, because you were mentioning earlier about how advanced radiation oncology has gotten and how specific it is for individual patient care. When you see that improving, do you believe that AI will continue to push cancer care into the direction of helping more and more patients cure cancer?
AI is being used in cancer care in many, many areas. For example, taking large data sets from radiology, digital imaging, say a mammogram or CT or MRI or PET scan, and trying to detect cancers that are hidden to the human eye. A radiologist can only see what is visible to us, but the AI can actually recognize patterns in the voxel by voxel level and can actually predict if a cancer might be present in the breast or somewhere else in the body, for example. AI is being used to analyze very large genomic data sets, so we are now capable of sequencing the entire genome with cost effectiveness and with a very quick turnaround. So the AI and machine learning technology can actually process those genomic data sets to predict the aggressiveness of the tumor, to predict the types of systemic agents, chemotherapy, or other drugs that the tumor will respond to. Also, to help match patients with clinical trials where there may be a drug available that is targeted to that patient's cancer. And these are all enormous innovations that are going to significantly improve the overall outcomes and cure rates for cancer across the board.
An incredible way to use vast amounts of information to get to a very specific outcome. Dr. Axelband, I want to ask you about that, because sepsis is something people worry about all the time if they're in the hospital. And how is AI helping you and your team detect that and treat it faster?
Sepsis is one of my passions, and it's also one of Donna's passions. And meeting metrics improves mortality. So how do we identify sepsis earlier? Is we're looking at, again, trends and patterns in patients' vital signs, their laboratory data. Patients are admitted with infection all the time, but not in the ICU. If a patient is on the floor, a deterioration index will trigger us with predictive analytics to evaluate a patient. If a patient is evaluating that they are deteriorating and they're worsening in their symptoms, we can trigger what's called sepsis alerts. Our sepsis alerts are a secondary intervention that brings along better resources, more intense resources for us to intervene on infections earlier and start treatments earlier for patients so they hopefully do not progress into severe sepsis, septic shock. And so we have achieved that very well at St. Luke's, and we're in top decile in comparing hospital network systems, and our AI technology has been amazing in helping us identify earlier.
Don, I want to turn to you for a second, because St. Luke's is recognized as one of the state's lowest cost providers, which is great news. And you talked about how it can help people on the outcome side. But what about efficiencies that can create cost savings? Where are you seeing AI helpful in that department?
High quality care is low cost care. right? If you're preventing infections and you're preventing complications, you're really bringing the cost of care down. We work with insurance companies to approve patients for certain admissions and treatments. We will be using AI technology to help us predict those patients who don't meet criteria and would get denied from a payer. So we're not having to use staff on the back end to try to overturn those. So that will be a cost efficiency for us. Another way is in our ORs. We're going to be able to improve the efficiency of the whole workflow in our OR suites, cut out unnecessary tasks, and improve turnaround times. A third area is the intensity of care that patients require. We will use to predict our nurse staffing. So we will be able to really apply good, sound judgment when we're staffing our units based on the severity of illness of our patients.
That's a big game changer, what you just mentioned, and I can see why you're passionate about it and why all of you are passionate about it, because it's having such a direct impact on every field of medicine. All right, up next, we're going to get questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about AI technology at St. Luke's University Health Network. Now we're going to read some questions from our viewers. Are all of you ready?
Ready?
All right. Donna, I'm going to start with you. What was the moment at St. Luke's when it was determined that AI was making a real difference in patient care?
It was with our results with sepsis. Sepsis was the first clinical condition that we applied AI to, and it helped us to move our compliance with the sepsis bundle of care, which is a very complicated bundle that's time dependent. And we have been able to achieve compliance across all of our hospitals with the bundle of care being done in a timely manner to the top decile of performance nationally. And we're at over 90% of our patients receiving that care in a timely manner. Nationally, the numbers are around 70% at this point.
Wow, incredible.
Yeah, so it's really, really helped us, and it's reduced our mortality rates for sepsis patients. So it impacts a tremendous amount of patients.
Great, excellent. All right, Dr. Harris, I think this question is for you. This viewer writes, my father was diagnosed with Lynch syndrome and has since developed prostate cancer. Can AI screen for hereditary conditions like Lynch and even predict genetics of a cancerous tumor?
St. Luke's has recently announced a partnership with a national innovative company called Helix, which is going to do population-based germline screening. So there are certain mutations in our bodies, in all of the cells of our bodies, that are called germline mutations, and they can lead to disease. And a lot of people with these syndromes don't know they even have these gene abnormalities until they develop that cancer. So Lynch syndrome, which is associated with prostate and colon cancer, as well as the two breast cancer and ovarian cancer genes called BRCA1 and 2, are going to be among the genetic abnormalities we're going to screen our population for. So the partnership with Helix involves us screening over 100,000 patients over the next 5 years for these more common germline abnormalities. And then we identify people who have those genomic alterations. We'll bring them in for cancer screening, because the best treatment for cancer is to prevent it from ever occurring in the first place.
Dr. Axelband, I'm going to ask you this one. Pneumonia is a fairly common thing that you see. It can lead to hospitalization, especially among older people. How can AI benefit a patient who is being treated for pneumonia?
AI with pneumonia patients, specifically in the hospital, will help with trending oxygen saturation, pulse, blood pressure, as well as laboratory data to see if there are trends or patterns that are heading towards a deterioration in the patient. So if the patient is having increased respiratory rate or decreased oxygen saturation, that will trigger an alert to my team to go and evaluate the patient. The patient will be evaluated and possibly kept on increased oxygen support, or possibly non-invasive oxygen support or respiratory support devices, hopefully preventing them from getting to the point of needing to be intubated and transitioned to the ICU. So AI is monitoring in the background 24/7, regardless of providers identifying it real time, or if something's happening after rounds, it keeps that safety net for us.
All right, Donna, this question is for you. Do you see the use of artificial intelligence further expanding to other areas of healthcare and improving the quality of care in the process?
So I think one area that we're looking at right now, which I think is fabulous, is with our patients with chronic kidney disease. So being able to predict if their chronic kidney disease is going to worsen over time, and being able to intervene earlier and prevent that from happening. Many people are dealing with chronic kidney disease, so again, it's another large population of patients that we will be able to intervene earlier on. I think also when you think about AI and the future of AI, I think we really don't know the full impact and all the possible case scenarios that will be out there. I think it's fascinating. I think, nationally we just have to make sure that any of the algorithms we're using have been tested and validated. That's really important. So we only use FDA-approved algorithms in our health system. And we work with companies like our health record, Epic, who develops them and gets them FDA approved. So I think it will be as expansive as the time and the ability and the resources to develop them.
Excellent, amazing. All right, Dr. Harris, this one's for you. If someone needs cancer care for prostate cancer, how can AI be used to improve radiation therapy?
So I described earlier this new modality that we've been able to roll out with the adaptive radiotherapy, which is an AI-driven platform. And prostate cancer is actually one of the main diagnoses we have been using to treat with this adaptive modality. So that has really allowed us to be much more precise. Believe it or not, the prostate moves around and is not in the same place every day, and the organs around it move around as well. So we are able to identify the precise location of the prostate, which is our target for treatment, and the nearby organs. And because of the increased precision and the ability to do these real-time replans every time the patient comes in, we've actually been able to reduce the number of treatments that a prostate cancer patient receives from around 40 down to 5. So it is a huge benefit for our patients. The outcomes are just as good, and is obviously much better quality of life and much less disruptive to our patients' lives.
Well, that is a huge difference in how AI is helping. All right, Dr. Axelband, I'm going to ask you the question that I think is on everybody's mind. Will AI take the place of seeing my nurse or doctor or care professional?
Absolutely not. AI is meant to support the patient as well as the healthcare team. The healthcare team is taking care of many patients. The patient is the most important. We want to make sure that we have all kinds of monitoring, trending, and background information for when we're not in the room with the patient to know what is going on. So if anything, AI may have more timely interventions, and you may be seeing more because of trends that are predicting and triggering alerts for us to reassess. So not going to take the place of a healthcare provider, your nursing staff, your advanced practitioner, your physician at all.
Well, that's great news, because I think it's important for people to know that they will still have that human contact. It's been wonderful talking to all of you. I had no idea how much was going on behind the scenes in medicine using AI to really advance patient care. So thank you all for joining us, and thank you to all of you for watching. For more information on how artificial intelligence is transforming healthcare at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.